Have you ever noticed how many older adults seem to fade away in their late 70s despite appearing perfectly healthy just years before? It's rarely heart disease, cancer, or some sudden medical emergency. No, it's something much more subtle and tragically ignored by mainstream medicine. I'm Dr. David, a specialist in men's health with over 30 years of experience helping seniors not just add years to their lives, but add life to their years through decades of clinical practice. Thousands of patients and mountains of research, I've uncovered patterns that most doctors miss. What if I revealed that one of the strongest indicators of vitality after 60 has nothing to do with your blood work lab results or daily exercise habits? Rather, it centers on something most older adults refuse to discuss, and countless others have wrongly discarded due to societal shame, outdated beliefs, or simple ignorance. Today, I'm going to expose a secret weapon for maintaining mental clarity, physical strength, and emotional wellness throughout your 80s, 90s, and even beyond. And here's what's truly amazing. You don't require costly prescription drugs, intensive exercise programs, or restrictive dietary plans. This remarkable resource already exists within your own body, just waiting to be rediscovered. Stick with me, because I'll guide you through the fascinating research and straightforward techniques you can begin using right now to restore a crucial element of your well-being, and I guarantee the insights in our final discussion will revolutionize your entire perspective on healthy aging. Before we dive deeper, please hit that subscribe button and ring the notification bell to ensure you receive all our science-backed health content created especially for the senior community. If this topic speaks to you, comment 1 below. If you have doubts or questions, leave a 0. Your engagement helps us deliver exactly what you need. Now that you recognize how essential this forgotten dimension of health really is, let's explore one of the most insidious yet destructive challenges confronting today's seniors. A silent crisis that gradually drains vitality, compromises physical function, and hastens decline. Decades prematurely, the abandonment of intimate physical connection and personal care. As we age, our bodies undergo predictable changes. After 60, both men and women experience shifts in hormone production, circulation, and neurological function. What many don't realize is how these changes interconnect with overall health outcomes. According to research published in the Journal of Sexual Medicine, regular sexual activity, including solo sexual expression, correlates with numerous health benefits in older adults. Dr. Barry Komisaruk's groundbreaking neuroimaging studies at Rutgers University show that sexual arousal activates multiple brain regions simultaneously, promoting neuroplasticity and cognitive function. Here's what happens physiologically during sexual arousal and climax. Cardiovascular benefits. Sexual activity increases heart rate and blood flow, providing cardiovascular exercise similar to moderate physical activity. The American Heart Association notes that sexual activity burns approximately 3 to 4 calories per minute, comparable to walking at a moderate pace. Neurological impact. During arousal, the brain releases a cocktail of beneficial neurotransmitters: dopamine for motivation and pleasure, oxytocin for bonding and stress reduction, and endorphins for natural pain relief. These chemicals support mood regulation and may help protect against age-related cognitive decline. Hormonal response. Regular sexual activity, including masturbation, can help maintain testosterone levels in men and support overall hormonal balance in women post-menopause. Research from the New England Research Institute shows that men who remain sexually active maintain higher testosterone levels compared to those who become sexually inactive. The key insight here is that sexual health isn't separate from general health. It's an integral component of successful aging. Let's address some persistent misconceptions that prevent older adults from maintaining healthy sexual practices. Myth 1. Sexual desire naturally disappears with age. Medical reality. While libido may fluctuate due to hormonal changes, medications, or health conditions, the capacity for sexual pleasure and the benefits of sexual activity don't simply vanish. The landmark Massachusetts male aging study found that while erectile function may change, interest in sexual activity often persists well into the 80s and beyond. Myth 2. Masturbation in older adults is inappropriate or unhealthy. Medical reality. The American Sexual Health Association explicitly states that masturbation is a normal, healthy sexual activity with no harmful side effects. For older adults, it can be particularly beneficial as it doesn't require a partner and can be adapted to individual physical capabilities. Myth 3. If you don't use it, you won't lose it. Abstinence preserves sexual function. Medical reality. This is medically incorrect. The phrase "use it or lose it" actually applies here. Research published in the American Journal of Medicine shows that pineal tissue requires regular blood flow to maintain elasticity and function. Similarly, for women, regular sexual activity helps maintain vaginal tissue health and lubrication. Myth 4. Sexual health problems are just part of normal aging. Medical reality. While some changes are normal, many sexual health issues in older adults are treatable. The key is distinguishing between normal aging and addressable medical conditions. Let's examine what the medical literature tells us about the consequences of complete sexual inactivity in later life. 1. Cardiovascular impact. Sexual activity provides natural cardiovascular exercise. Without this stimulation, older adults may miss opportunities for heart-healthy activity. A study in the American Journal of Cardiology found that men who had sex less than once per month had nearly twice the risk of cardiovascular disease compared to those who remained sexually active. 2. Hormonal decline. Sexual arousal and orgasm trigger the release of various hormones. Without this natural stimulation, the body may reduce production of these beneficial chemicals. This can contribute to decreased testosterone in men, reduced growth hormone production, lower levels of DHEA, dehydroepiandrosterone, diminished oxytocin production. 3. Neurological changes. Sexual activity engages the brain's reward pathways and promotes neuroplasticity. Research from Barry University shows that sexually active older adults score higher on cognitive tests compared to their inactive peers. The brain, like other organs, benefits from regular stimulation. 4. Physical changes in sexual organs. For men, lack of regular erections can lead to what urologists call penile fibrosis, a stiffening of tissues that can make future sexual activity more difficult. Dr. Irwin Goldstein's research at Boston University shows that regular erections help maintain penile tissue health through improved oxygenation. For women, lack of sexual activity can contribute to vaginal atrophy, decreased lubrication, and loss of tissue elasticity, conditions that can make future sexual activity uncomfortable or painful. 5. Prostate health considerations. The Harvard Health Professionals follow-up study, which tracked over 29,000 men, found that men who ejaculated 21 or more times per month had a 20% lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. While this research is ongoing, it suggests that regular ejaculation may help clear potentially harmful substances from the prostate. Based on current medical understanding, here are evidence-based recommendations for maintaining sexual health in later life. Step 1. Medical consultation. Before making any changes to your sexual health routine, consult with your healthcare provider. They can review medications that might affect sexual function, address any underlying health conditions, Provide guidance specific to your medical history. Discuss any concerns about resuming sexual activity. Step 2. Creating a comfortable environment. Physical comfort becomes increasingly important with age. Consider a warm, private space, supportive positioning with pillows if needed, quality lubricants to address natural changes in body chemistry. Taking your time. There's no need to rush. Step 3. Mindful approach. Approach sexual self-care as you would any other health practice. Focus on sensation rather than performance. Practice deep breathing and relaxation. Pay attention to what feels good for your body now. Let go of comparisons to younger years. Step 4. Gradual progression. If you've been sexually inactive for an extended period, start slowly and gently. Allow your body time to respond. Be patient with physical changes. Celebrate small improvements. Step 5. Regular practice. Like any health habit, consistency matters. The Mayo Clinic suggests that regular sexual activity, whether partnered or solo, provides cumulative health benefits. Aim for whatever frequency feels right for your body. This might be 2 to 3 times per week for some, or less frequently for others. Let's discuss practical solutions for common challenges older adults face. Challenge 1. Physical limitations. Arthritis, mobility issues, or other health conditions don't have to end sexual self-care. Adaptations include using supportive devices or furniture, exploring different techniques that work with your body's current capabilities, considering topical preparations that can enhance sensitivity. Challenge 2. Medication. Side effects. Many medications can affect sexual function. Common culprits include blood pressure medications, antidepressants, antihistamines, pain medications. Work with your doctor to explore alternatives or timing adjustments that might minimize sexual side effects while maintaining medical benefits. Challenge 3. Psychological barriers. Shame, guilt, or performance anxiety can be significant obstacles. Consider speaking with a therapist who specializes in sexual health, joining support groups for older adults, reading reputable educational materials, remembering that sexual self-care is a form of health maintenance. Challenge 4. Partner considerations. If you have a partner with different needs or capabilities, communicate openly about individual health practices. Respect each other's choices. Consider couples counseling if needed. Remember that individual sexual health supports relationship health. It's important to view sexual self-care as part of a comprehensive approach to healthy aging. Research shows that older adults who maintain sexual activity often also exercise regularly, maintain social connections, have better sleep quality, report higher life satisfaction, experience less depression and anxiety. This suggests that sexual health both contributes to and reflects overall wellness in later life. The Baltimore Longitudinal Study of Aging, ongoing since 1958, consistently shows that older adults who remain sexually active tend to have better cognitive function, cardiovascular health, and overall quality of life measures. As we conclude today's discussion, let me emphasize these key points. Sexual health is health. Regular sexual activity, including masturbation, provides measurable health benefits that extend well beyond sexual function. It's never too late. While your body may need different approaches than in younger years, the capacity for sexual pleasure and its health benefits can be maintained throughout life. Medical support is available. Don't hesitate to discuss sexual health with your healthcare provider. It's a legitimate medical concern that deserves professional attention. Individual approach. What works for one person may not work for another. Find what feels right for your body and circumstances. Quality over quantity. Focus on the quality of your experience rather than frequency or performance metrics. Remember, taking care of your sexual health is taking care of your overall health. It's an act of self-respect and self-care that can contribute to a more vibrant, fulfilling later life. Thank you for joining me today for this important conversation. If you found this information helpful, please like, subscribe, and share with others who might benefit. Your engagement helps us continue providing evidence-based health information for the mature adult community. Until next time, take care of yourselves, all of yourselves.